A 71-year-old man passed away this morning, and the cause? Something that could have been prevented. Are you unknowingly making these same mistakes? Stick around to learn the 6 things you must avoid in your 70s to live a longer, healthier life. Aging is a privilege, but how you age matters. Many seniors unknowingly engage in habits that shorten their lifespan or drastically reduce their quality of life. In this video, we'll reveal 6 crucial mistakes that can lead to serious health issues or even premature death. By the end of this video, you'll know exactly what to avoid and how to make simple changes that could add years to your life. Watch this video until the end. Don't skip a single point. Ignoring even one of these warnings could mean missing out on a life-saving lesson. Neglecting regular health checkups. Many seniors avoid regular health checkups, assuming that if they feel fine, there is no need to see a doctor. However, many serious health conditions, such as high blood pressure, diabetes, and certain types of cancer, develop silently with no obvious symptoms in the early stages. By the time noticeable symptoms appear, the disease may have already progressed to a dangerous level, making treatment more difficult and recovery less likely. Scientific research consistently shows that early detection through regular screenings can significantly improve health outcomes. According to a study published in the Journal of the American Medical Association, JAMA, individuals over 70 who undergo regular checkups and preventive screenings have a higher life expectancy and a lower risk of hospitalization. Routine blood tests, blood pressure monitoring, and screenings for common age-related conditions such as osteoporosis, vision loss, and cognitive decline can detect problems before they become life-threatening. Consider the story of Robert, a 73-year-old man who never prioritized doctor visits. He felt healthy and believed that since he had no major complaints, there was no reason to see a physician. One day, he experienced mild chest discomfort, which he dismissed as indigestion. A few weeks later, he suffered a severe heart attack. Upon hospitalization, doctors discovered that Robert had long-standing high cholesterol and hypertension, conditions that could have been managed effectively if detected earlier. His medical team informed him that routine screenings and medication adjustments could have significantly lowered his risk of heart disease. Robert's story is a powerful reminder of the importance of proactive healthcare. Regular checkups are not just for treating illnesses but for preventing them. Early detection allows for better management of conditions, reducing complications and improving overall quality of life. Many life-threatening diseases can be controlled with timely medical intervention, giving seniors the opportunity to maintain their independence and enjoy their later years with better health. In conclusion, avoiding regular checkups is a dangerous mistake that can lead to severe health issues. Seniors who take control of their health through routine screenings, doctor consultations, and preventive care significantly improve their chances of living longer, healthier lives. As Robert's experience shows, a simple checkup could mean the difference between life and a medical emergency. Prioritizing health through regular medical visits is one of the most effective ways to prevent unnecessary suffering and ensure a higher quality of life in old age. Ignoring sleep. Quality sleep plays a critical role in overall health, yet many seniors neglect its importance, often dismissing poor sleep as a normal part of aging. However, sleep quality directly impacts brain function, heart health, immune system strength, and even longevity. When sleep is disrupted or insufficient, it increases the risk of serious health conditions such as cardiovascular disease, stroke, and cognitive decline, including Alzheimer's disease. Scientific studies have shown that adults over 70 who sleep fewer than 6 hours per night are more likely to experience memory loss and a weakened immune system. Research published in the Journal of Sleep Research found that poor sleep increases the risk of high blood pressure and inflammation, both of which contribute to heart disease. Additionally, sleep is essential for brain detoxification, as it helps clear out harmful proteins that can accumulate and lead to neurodegenerative diseases. Take the story of Mary, a 70-year-old woman who struggled with restless nights for years. She often woke up feeling exhausted, but she believed that fragmented sleep was just part of aging. Over time, she noticed increasing forgetfulness, difficulty concentrating, and higher levels of anxiety. Her doctor suggested that she undergo a sleep study, which revealed she had undiagnosed sleep apnea, a condition that repeatedly interrupted her breathing during sleep, preventing deep rest. With treatment, including lifestyle adjustments and a CPAP machine, Mary experienced significant improvements in her energy levels, memory, and mood. Mary's story highlights the importance of addressing sleep problems rather than accepting them as inevitable. Simple lifestyle changes, such as maintaining a consistent bedtime, reducing screen time before bed, and creating a comfortable sleep environment, can significantly improve sleep quality. Seeking medical advice for sleep disorders like sleep apnea or insomnia can also lead to life-changing improvements in health and well-being. In conclusion, ignoring sleep issues is a mistake that can have serious long-term consequences. Quality sleep is essential for maintaining cognitive function, heart health, and overall vitality in later years. As Mary's experience shows, taking sleep seriously and seeking solutions can lead to profound benefits, helping seniors stay sharp, energetic, and healthier for years to come. Prioritizing rest is not a luxury, it is a necessity for aging well. Being physically inactive, a sedentary lifestyle, is one of the biggest mistakes seniors can make, yet many over 70 fall into the habit of reduced physical activity. As people age, mobility may become more challenging due to joint pain, muscle weakness, or fear of falling. However, avoiding exercise only worsens these problems, increasing the risk of frailty, chronic diseases, and loss of independence. Scientific studies have repeatedly shown that regular movement improves heart health, strengthens bones, and enhances overall well-being. Research published in The Lancet found that just 30 minutes of moderate exercise per day can lower the risk of heart disease, stroke, and early mortality by up to 30%. Exercise also improves circulation, preventing conditions like high blood pressure and diabetes, which are common among seniors. Moreover, physical activity releases endorphins, which boost mood and help prevent depression and anxiety, both of which are prevalent in older adults. Consider the story of George, a 75-year-old who had always been active in his younger years but became increasingly inactive after retirement. He spent most of his days watching television, and over time, he began experiencing difficulty standing up from chairs and climbing stairs. His doctor warned him that his lack of movement was causing muscle loss, which put him at risk of falls and injuries. Determined to make a change, George started with short, gentle walks around his neighborhood and gradually incorporated simple strength exercises. Within months, he noticed increased stamina, better posture, and improved balance. More importantly, he regained the confidence to move without fear of falling. George's story is a clear example of how even small efforts to stay active can lead to significant improvements in mobility and quality of life. Exercise doesn't have to mean lifting heavy weights or running marathons. Simple activities like walking, stretching, or chair exercises can make a world of difference. In conclusion, avoiding physical activity accelerates decline, making seniors more vulnerable to disease and loss of independence. Regular movement is essential for maintaining strength, balance, and longevity. As George's experience shows, it is never too late to start, and even small steps toward an active lifestyle can lead to transformative results. Prioritizing movement is one of the best decisions seniors can make to ensure a healthier, more fulfilling life. Not managing stress and mental health. Chronic stress and unmanaged mental health issues can have a devastating impact on overall well-being, yet many seniors neglect this aspect of their health. As people age, they often face new stressors, such as health concerns, financial worries, loss of loved ones, or social isolation. When stress is not properly managed, it can lead to increased inflammation in the body, higher blood pressure, and a weakened immune system, all of which contribute to serious health problems, including heart disease, stroke, and cognitive decline. Scientific research has shown that prolonged stress increases levels of cortisol, a hormone linked to inflammation and aging-related diseases. A study published in the Journal of Gerontology found that seniors with high stress levels were at a greater risk of memory loss and dementia compared to those who actively managed their stress. Additionally, chronic stress can weaken the body's ability to fight off infections, making seniors more susceptible to illness. Mental health issues, such as depression and anxiety, are also common among older adults, yet they often go undiagnosed and untreated. Consider the story of James, a 72-year-old retired accountant who struggled with constant stress after his wife passed away. He withdrew from social activities and spent much of his time worrying about finances and his future. Over time, his blood pressure increased, and he began experiencing frequent headaches and fatigue. Concerned about his health, his daughter encouraged him to join a local senior support group. Initially hesitant, James eventually found comfort in talking to others facing similar challenges. He also took up meditation and started engaging in daily walks, both of which helped lower his stress levels. Within a few months, he felt more energetic and at peace. James's story highlights the importance of managing stress and prioritizing mental health. Simple practices such as meditation, socializing, engaging in hobbies, or even seeking therapy can significantly improve emotional well-being. Taking active steps to reduce stress can lead to better sleep, improved heart health, and a sharper mind. In conclusion, ignoring stress and mental health in old age can lead to serious physical and cognitive decline. As James's experience shows, prioritizing relaxation, connection, and emotional well-being is crucial for living a longer, healthier life. By addressing stress proactively, seniors can enhance their overall quality of life and prevent many common age-related health issues. Maintaining a poor diet in your 70s is one of the biggest mistakes that can lead to serious health problems. As the body ages, its nutritional needs change, requiring more essential vitamins, minerals, and high-quality nutrients to support overall health. Unfortunately, many seniors continue eating the same way they did in their younger years, consuming processed foods, excessive sugar, and unhealthy fats. These poor dietary choices can increase the risk of heart disease, diabetes, obesity, and cognitive decline. Scientific studies have shown that a diet high in processed foods and added sugars contributes to inflammation in the body, which is a major factor in many age-related diseases. According to research published in the American Journal of Clinical Nutrition, seniors who follow a nutrient-rich diet, such as the Mediterranean diet, which emphasizes fruits, vegetables, lean proteins, and healthy fats, experience better heart health, improved brain function, and lower rates of chronic illness. Proper nutrition also helps maintain muscle strength, reducing the risk of falls and fractures. Consider the story of Helen, a 74-year-old woman who had always relied on convenience foods like frozen meals, sugary snacks, and fast food. Over time, she began feeling sluggish, gained weight, and was diagnosed with high cholesterol and prediabetes. After a visit to her doctor, she realized that her diet was contributing to her declining health. With guidance from a nutritionist, she started incorporating more whole foods, such as leafy greens, nuts, fish, and whole grains. Within months, Helen noticed increased energy levels, better digestion, and improved blood sugar control. Her doctor even reduced some of her medications as a result of her healthier lifestyle. Helen's story is a powerful example of how changing dietary habits can transform health, even in later years. Eating nutritious foods is not just about preventing disease but also about maintaining vitality, mental sharpness, and physical strength. Simple dietary adjustments, like reducing processed foods, drinking more water, and eating more fiber-rich meals, can make a significant difference in longevity and quality of life. In conclusion, poor dietary choices can accelerate aging and lead to serious health complications, but making mindful food decisions can reverse or prevent many of these issues. As Helen's experience shows, it's never too late to adopt a healthier diet. Prioritizing nutrition is one of the most effective ways to stay strong, active, and independent well into old age. Refusing to adapt to age-related changes. Refusing to adapt to age-related changes is a common mistake that can lead to serious health risks and a decline in overall quality of life. As people enter their 70s, their bodies undergo natural changes in mobility, vision, balance, and energy levels. Ignoring these changes or resisting necessary adjustments can result in accidents, injuries, and even a loss of independence. Instead of seeing adaptations as a loss of freedom, they should be viewed as smart choices that enable seniors to maintain their safety and well-being for longer. Scientific studies emphasize that making small adjustments to accommodate aging-related challenges significantly reduces risks. According to research published in the Journal of Aging and Health, seniors who take proactive steps, such as using mobility aids, modifying their homes for safety, and adjusting their daily routines, experience fewer falls, maintain better physical health, and stay independent longer. One of the most common causes of hospitalizations in seniors is falls, often due to ignoring physical limitations and failing to make necessary changes to their environment. Consider the story of Mark, a 71-year-old man who prided himself on being strong and independent. Despite noticing that his balance wasn't as stable as before, he refused to use a cane or make safety modifications at home. One day, he tripped over a rug in his living room, resulting in a severe hip fracture that required surgery and months of rehabilitation. During recovery, he realized that if he had made small adjustments, such as installing grab bars in his bathroom, removing tripping hazards, and using a cane for support, he could have avoided the injury altogether. After his accident, Mark embraced these changes, allowing him to regain confidence and move safely. Mark's story illustrates the importance of acknowledging and addressing age-related changes rather than resisting them. Simple adjustments, such as wearing supportive shoes, accepting mobility aids, or reorganizing the home for accessibility, can prevent serious injuries and enhance overall quality of life. In conclusion, refusing to adapt to aging-related changes can lead to unnecessary risks, while making smart adjustments ensures safety, mobility, and independence. As Mark's experience shows, embracing change is not about giving up freedom, it's about preserving it. Taking proactive steps today can prevent hardships and help seniors continue living comfortably and confidently. These 6 mistakes are preventable, but only if you take action. Prioritizing your health, staying active, managing stress, and making small lifestyle adjustments can help you live longer and better. Don't wait until it's too late, start making these changes today. Which of these mistakes surprised you the most? Let us know in the comments. Share this video with your loved ones so they can avoid these pitfalls too. And if you're serious about living a healthier, longer life, subscribe for more practical tips. Together, we can make our 70s and beyond the best years yet. Your future health depends on what you do today. Make every choice count.